let's continue to count down the top 2023 advances in breast and gynecologic cancer this year. I'm Dr. Eleanor Duplinski. I'm a board-certified medical oncologist, and we're down to number 2, and we're talking about several new approvals in the metastatic breast cancer space. Notably, this year we saw 3 FDA approvals, and they were all for hormone receptor positive, HER2 negative disease. And sometimes that happens in prior years. We've seen more approvals for triple negative or HER2 positive, but this year we had 3 metastatic breast cancer approvals, again, all for hormone receptor positive, HER2 negative. So the 3 drugs, number 1, are Trodelvy or Sacituzumab govitecan. It's an antibody drug conjugate. It is already approved for triple negative breast cancer, and we saw the addition of this approval. It is an IV infusion. It is given to patients who've developed disease progression after at least 2 prior chemotherapy treatments, and it is given on day 1 and day 8 of a 21-day cycle. Number 2, we saw the approval of Elacestrant, which is an oral medication. It's a class of medications called SERD, or selective estrogen receptor degraders. It's given for patients who have progressed or developed disease progression on prior endocrine therapy and who carry an ESR1 mutation. Notably, that ESR1 mutation can emerge, so we recommend testing for that ESR1 mutation at the time of disease progression. It can either be done by doing another biopsy, or as more commonly recommended, doing a liquid biopsy or doing a blood test to detect the presence of that mutation. The company that we most often use is Guardant to test for that. And the 3rd approval is Capivasertib or Truqap. This is an oral medication that is an AKT inhibitor, and it is for patients that have a AKT pathway alteration. So they have mutations in either PIK3CA, AKT, or PTEN. And I think what some of these approvals underscore, as we talked about previously, is the importance of molecular testing, especially for metastatic breast cancer, so that we can see if people are eligible for these medications, because more and more these approvals that come are very targeted. They're for patients who express specific mutations, so that really, again, that's highlighting that precision oncology focus that has developed over this past year and built on what's already been there. Let me know what questions you have. Do you have experience with any of these 3 medications, Trodelvy or Sacituzumab govitecan, Capivasertib, Truqap, or Elacestrant, or Orserdu? Love to know your thoughts, comments, let me know.